Today we'll meet John Lynn, the man behind Emr and Hipaa.com and healthcarescene.com.
Hey Wisdom Seekers, I am here for another fabulous episode of Innovators in Healthcare Technology. And I have John Lynn sitting here in front of me. Welcome, John.
Thanks, glad to be here.
Good, how are you doing today?
Life is great. I'm lucky I live in the beautiful Las Vegas and it's heaven.
Nice. I'll be there next month for, or actually this month for the Life at 50 conference. So hopefully I'll get to see you there. Well, you guys,
Great.
The reason I wanted to have John on today is he truly has his finger on the pulse of everything healthcare. In fact, he owns a website called healthcarescene.com, which is a network of over 15 blogs with, get this, 5,000 articles or more. It's growing every day, isn't it? So tell us a little bit about healthcarescene.com.
So healthcarescene.com is really a network of healthcare IT blogs. Like you said, we have 15 different ones. The top ones are Emr and Hipaa.com and Emr and Ehr.com. And really it started talking about electronic medical record, but now it's expanded to pretty much anything healthcare IT related, smartphone related, mobile health, and it crosses the full gamut of healthcare technologies.
Nice. So how did you get here? I mean, you've written over 5,000 articles. What got you to this point that you're so passionate about healthcare technology?
Right. So about 8 years ago, I got a job working in an electronic medical record at a health and counseling center at a university. And when I was doing it, I had so much to learn since I hadn't worked in healthcare. And so I decided, why don't I start a blog and share my knowledge with other people? When I look at those posts, I realized I was clueless at the time. But that was part of the learning process. And so I started doing it, and I put ads on from day one, and wow, they actually clicked through. I called it date money when I first started. I'd take my wife on a date, and then just over time, it really grew and grew.
Nice. So when did you said you started this 8 years ago?
Yeah, 8 years ago. I think we're at 7.5 years now or something like that.
Yeah. Are you doing this full time now?
I am. About 3 years ago, I quit the day job to do it full time.
Nice. Congratulations on that. There's so much going on right now, and it was hard to nail John down for an interview because he's traveling so much, and so I was nervous I wasn't going to be able to get him on for this. So where have you been? What's going on out there? I think you were recently at TED-Med, correct?
Right. So I did the trifecta of what I call HIMSS, which is the big health IT conference. Then I went to South by Southwest, which has a whole healthcare campus, although it's mostly known for music and everything, but it has a huge healthcare presence.
Sure.
And then I hit TED-Med. So by then I was just glad to still have a wife, but yeah, so TED-Med was an incredible experience of TED-Med is really unique because they take all these various people from various industries for what they call multidisciplinary collaboration. I mean, for example, one time they took these dancers and put them together with a cell biologist to study how cells would move. So he used dancers to try to understand how cells move. But what was really interesting, he benefited in his research of cellular information, but then also the dancers benefited because they saw how the cells moved and thought, maybe we should try to do that. And they created this piece that was beautiful.
Was that presented on the stage at TED-Med?
Yeah, absolutely. So he would describe how cells were moving, and these dancers would move like the cells, if they were in a cell. And then after that, he said, now here's what the piece that came out of what they learned acting like cells. And they created this really raw, beautiful piece. And I'm actually a huge dance fan. I even have a blog about So You Think You Could Dance. So for me watching it,
Nice.
I was like, I wonder how this will compare. And it was like nothing I'd seen on the show because it was so different and unique.
Okay, so you have a whole nother blog. You didn't even mention that, but I absolutely love that show. But it's all connected, and that's what I love about the TED Talks is that it just takes you to a whole nother level, and they just explore. So that's a great example. Any other favorites from TED-Med?
So there were so many, but a couple that really, for me, were my top ones is probably Jonathan Bush from Athena Health, who he talked about the upper right quadrant syndrome that we have in healthcare, that all these companies get so big. And so then they move as leaders in the upper right quadrant of really large and lots of revenue. And then they can't really leave there because everyone's afraid to use some startup company because they think, oh, well, if they're not in the upper right quadrant, maybe I shouldn't use them. I mean, it's my health after all. And yet, then it kind of positions them that they can't ever leave it, and no company can break into that upper right quadrant. I mean, he was naming names and everything, so that was really good. And another one was Zubin Damania, who is more affectionately known as ZDog MD. In fact, you should link to some of his videos. It will blow some of your readers away. He mixes rap with education. I mean, he's absolutely insane, but he's also doing something really unique. I'm a little biased since he's doing it in Las Vegas, but he's creating a new clinic that really focuses on wellness. So it's not just treating the patient when they're sick, but how do we merge the side of wellness with sick care? And how do you do that with keeping in mind that insurance shouldn't be part of primary care. That was one of his big comments. He said, really, we should care for the person, regardless of whether it's well care, whether it's disease care, whether it's reimbursable. We want to provide them whatever care is needed. And then, I think it will save our healthcare costs long term. But he's a really unique individual that just entertains and informs.
Nice. Okay, I'm gonna have to go check out that video and possibly put it in here as well.
Yes, it does.
ZDog MD. Okay. So, do you think with EMR and EHR, and can you explain really quickly what those terms mean to our audience that has maybe heard those terms but they don't know exactly what that is?
Sure. So EMR stands for electronic medical record, and EHR stands for electronic health record. Now, if you talk to most doctors, they'll say they're the same. I mean, at the core, electronic medical record or electronic health record or EMR, EHR are the same from their perspective. In fact, most doctors probably still use the old term EMR. If we were to get into the semantics of what's different, most people would say it becomes an EHR once the patient gets involved as well. So the EMR, the electronic medical record, is what was documented by the doctor, by the nurses, by the healthcare givers. Then once you involve the patient, where the patient can access it through a portal, where they can insert information into the record, where maybe some of their device information gets put in, however that information gets in there. But once you involve the patient and other people in the process of documenting the record, then it becomes what they call an electronic health record, EHR. So, that's really the big difference. I guess the other big difference is the government said they have $36 billion of stimulus money for EHR, and so more people are using the term EHR now.
Yeah, money talks. Okay, so thanks for explaining that. So with that being said, and this talk about technology, one of your latest blog posts I really enjoyed, and it was about, does all of this technology actually help healthcare? So what are your thoughts about that, since you are out at all these conferences listening to the manufacturers?
Sure. So, I mean, the obvious answer is it depends, right?
Yeah.
And the other obvious answer is some does and some doesn't, right? But if you look at it from a more general perspective, the question is going electronic valuable? And in my core, I believe it does and it can. The problem I have and my fear is, in healthcare, are we implementing the technologies that are going to create a great foundation going forward that will benefit us long term? Or are we implementing some technologies that are built on a foundation that's really old, antiquated, and easily falls apart, that then when we really want to do advanced technologies and advanced implementations, we just won't be able to, because the foundation is so poor that we can't accomplish what we really want to. And as I look at it, there's a number of examples where I think we can see that this is happening, and it kind of scares me, because if we're using technology that's not the latest, we won't be able to do things like genomic medicine, right? So if the data is trapped in a database, is stored in some technology that won't let us get it out, so that we can analyze it together with some really, really advanced technology like genomic medicine, where it takes your genome and it gives you a therapy or a drug that really applies to you and your specific genomic profile. Well, we need to be able to merge that data. But if the technology doesn't support that,
Right.
I don't care if we have the genomic data, you won't be able to do it, right? Or we'll have to have separate systems. So I think that's what's a little bit, I have a little bit of fear there, especially in the electronic medical record world, electronic health record world. But there are other signs that are really interesting. And I think that is in the genomic medicine, is in the mobile health side of things, where we're seeing the latest and greatest technologies being applied. And so I think there we see a ton of promise on the latest technologies that are out there.
That's a good insight about the innovation. So, with innovation, how does HIPAA and the HIPAA laws apply to accessing this data? And can patients feel safe knowing that their data is private?
So, there's really two perspectives on HIPAA. One is the provider perspective, which many times says, oh, HIPAA, I'm afraid of it. And so I have to do everything possible to not be afraid of it. Even though HIPAA itself is actually quite extensible, and it's quite open to the idea that you can share data, one, if you have patient consent. So the patient needs to be involved in the consent of what you're doing with their data, which is good, and every patient loves, and the doctors are fine with that too. But then two, that you've made a reasonable effort to secure that data. The problem is many doctors say, oh, reasonable effort to secure data, forget it, I just won't do it. Because they get afraid, what if I do, what does reasonable effort mean, and things like that. But so HIPAA actually provides for being able to share that data and use it where appropriate if you have consent. But and so many doctors though go into this fear of, oh, maybe I just shouldn't do it. And I think that's going to change and that's going to evolve, especially as the next generation of doctors comes in. But then from the patient side, they look at it and say, okay, will HIPAA protect me from any sort of violation of my privacy, and will it do it? And I think many are fearful that it won't provide that. Although when you think back to what I just said about the providers, they usually edge on the side of not sharing something that they should. And so in many ways, HIPAA actually provides a barrier to more efficient care and better care. In fact, we would be better served if people realize that if people shared data, we would have more value, then we would have more sharing happening in healthcare. In fact, I've talked about this in another interview I did. If people just understood the benefit of sharing data, like if people were given the message, if you share data, you will get better healthcare. If you say that, every single patient in the entire world is happy to have that data shared. I mean, a simple example, if you share your data with a specialist and you're in the general medicine, you'll get better healthcare. Everyone will say, absolutely. Please share. In fact, in their mind, they're saying, you're not doing that already? Because it's so natural for it to happen. But then if you ask the person the same question, do you want your data shared? Oh, no, keep it private, right? Because there's that fear. Right. But I guess that's the missing element, is share the data with the people who need it so I can get better care. And so we need to embrace that and realize that won't compromise what we're afraid of, which is that, some insurance company will discriminate against us because they have data, or that we'll be in some lawsuit because our healthcare data got out, or that someone will do Medicare fraud on our data, because it's so rare that that's what happens.
Right. Good insight on HIPAA. And that sounds like a discussion that is happening right now, and of course it's happening on your blog. So since you're out there and you've been to so many conferences, you're talking to all the leaders, what do you think is maybe I don't know if you can narrow it down to the top 3 big change makers and big innovators out there right now?
So how about I give you 3 categories generally, with
Okay.
maybe a couple names that you could see the specific companies, but because there's so many. I mean,
So many.
I can't remember the last statistic, something like 60,000 mobile health apps or something. It's like, how do you even process that? I do
Yeah.
this full time and I don't, right?
Yeah. And
So,
the categories are huge too. So,
yeah,
yeah.
exactly. So, how about 3 categories? One is, I think for your population, one of the biggest ones is the home monitoring device.
Hmm.
Not to be curt, but it's the I've fallen and I can't get up class of device, right? Well,
Hmm.
before the I've fallen and I can't get up, you would have to push the button and it would notify, the caregiver or whoever, right? Well, the latest class of device in that is incredible. I mean, there's no more touching to click it so that then it does it. It will just recognize when you
When you
fall,
fall.
when something happens. I mean, it's gotten so advanced that it will follow your activity in the home and it will create an algorithm that says, okay, normally you move this much.
Sure.
And then if you're not moving that much now, I can notify your caregiver and say, hey, you might want to give them a call and see how they're doing or pay them a visit.
Right.
And so it's just that whole class of device, which really was done by implementing an accelerometer,
Hmm.
something that comes in every single phone,
Yep.
and simple device like 3G connectivity, which is mobile connectivity. When you combine those two, you can do amazing things, and that's what they've done, I think, with those devices.
Yeah.
The second class of device is
Hmm.
really the telemedicine type of interaction. I mean, we're doing this over Skype, and Skype could be considered one form of telemedicine, although it's not encrypted, or you can discuss if that meets HIPAA requirements. But there's
Sure.
a whole series of technologies where you can interact either with your caregiver,
Hmm.
with your doctor, with a dietitian, whoever it might be. I mean, mental health has a huge role in this. There's a whole series of devices, and one of the most interesting devices in this area is the mobile telehealth. So you have a robot that can go around your house and can go and see you. So say you're someone that you can't move around that much, your caregiver can use this mobile device and see where you're at. And if they can't find you in the main room because that's where the video was, they can
Hmm.
drive it over to the kitchen and see if you're there and see what's going on. And I think that's really, really interesting.
That is absolutely interesting. Well, when you look at, you mentioned the second category, I thought of immediately websites like powwow.com and
Mhm.
liveninja.com. And those are, it's taking Skype to a different level that involves a way of accepting payment from that company. And you have everyone from lawyers, doctors, yoga instructors giving advice for payment. They get to set the payment. So I think it's just Skype is the beginning. Then we're on to Live Ninja, Powwow, and now this can be done in a medical capacity to be able to reach more people in rural areas or who are possibly, like my audience, maybe aging in place and can't get
Sure.
out to the physician. So amazing categories, amazing insight. Thank you so much for being on the show today and sharing all this awesome information. So if someone wanted to find you, what are the top three? I think it's three websites that people can find you at.
Yeah,
Healthcarescene.com, right?
sure. So
Uh-huh.
healthcarescene.com links to all of them. It's kind of the
Okay.
overall network. The biggest ones are EMR and Hipaa.com. One
Okay.
P, two A's, right? If you want to do HIPAA. The
Uh-huh.
next one is EMR and EHR.com. And the one that's probably best for yours is actually smartphonehc.com. So smartphone healthcare, smartphonehc.com, where we cover the mobile apps in that environment. So there could be a number of interesting companies there.
Excellent. So I'll list all of those down below. You guys go check them out. John Lynn, thank you for joining me today.
Thanks. It's
All
great
right.
talking with you.
Bye, everyone.
Hey you, where are you going? Stick around for another video. Left or right? Left or right? Hey, don't forget to subscribe.